So we are going to be making all of these slides available to you after today. We are also recording this session here, so that link will be included in that follow-up email as well. So don't worry too much about scrambling to write everything down. We will make this information available to you. I'm going to try to make this as interactive as I can. I know it's a little awkward in like a virtual format, but sometimes I'll be asking all of you questions, but please feel free to ask me if you have any as well. I'm hoping to dedicate some time at the end to be able to address any questions that may come up. So you have a couple options that are available to you. As of right now, we are all in a webinar format. So all of your cameras as well as microphones should automatically be turned off. So don't worry about accidentally turning anything on. That should not happen. But you do have different ways to interact. So one of them is your chat box feature. Feel free to use that to add any comments to the discussion or drop your questions in there. You can either send a message to me and Dr. G, who is my tech support for today, or you can make it so all panelists and attendees can see, so everyone who's on the webinar can see that message. So a couple different options, even with that. You also have a Q&A feature as well. If any questions pop up between now and the end of the presentation today, I'll be kind of monitoring the chat box and I'll answer the ones that I am able to in real time. But again, we'll have that time at the end as well to dedicate to any questions. So use that Q&A feature. If you do have any, go ahead and drop them in there. But with that, hello, my name is Amanda Martinez. I am the training program manager for Mental Health America of Hawaii. And a little bit of an overview of what we are going to be covering in today's session, right? So I'm just going to touch a little bit on who we are as an organization. Again, we're going to take a look at a snapshot, right? Some statistics for our youth here in Hawaii in regards to their mental health. We're going to be talking through what those different challenges are, what that looks like, and then what are we going to be able to do about it, right? What are the different ways that we can help to support the youth that we have in our lives, either personally or professionally? So Mental Health America of Hawaii has been around in the state of Hawaii for over 75 years. We like to consider ourselves a statewide organization with our main offices on Oahu as well as Maui, but we do try to partner with as many schools and organizations and community members as we can, just to extend our reach as far as we can across the state to be able to spread information and resources as widely as we can as well. We really try to promote mental wellness through 3 different areas as a part of our mission. So that's education, advocacy, and services. So historically, Mental Health America of Hawaii has been the lead of or been a member of various coalitions and still are, and task forces really advocating for increasing access to mental health care services, resources, and promoting overall mental health wellness. Right. Education is another part of our mission, and this is really where the bulk of my time is being spent, is offering these community trainings, as well as specialized trainings for different organizations, or actually going into schools and offering kind of self-care trainings or our youth suicide and bullying prevention trainings. So again, trying to spread our reach as far and wide as we can. Here's a list of some of the trainings that we have been currently offering. Right now, we have made a shift to convert all of these programs into a virtual format. It's been a process, much like everyone else has been doing as well. But if you are interested in learning a little bit more about any of these trainings, feel free to reach out to us. Our website will be made available to you, but you can go there, you can sign up for our newsletter. There's a portion on our website as well where we post training schedules for every month. Or you could just send us an email as well, requesting a training. Thank you, Dr. G, for dropping our website in that chat box there. Feel free to reach out. We're always happy to let you know when the next trainings are being offered, or take any kind of requests if you're looking for like a mental health wellness training for your staff. We do those too, so feel free to reach out. Or that. And then the third area of our mission is really services, right? So we don't necessarily provide any direct services to people, but rather what we aim to do as an organization is connect people to those services or to those resources, right? So we kind of help point people in the right direction. So we have a finding helpline. Feel free to call our office. Someone is usually available Monday through Friday during those kind of normal business hours for about 9 a.m. to 4 p.m. We're always happy to answer any questions or provide any information or resources that you might need. We also have a Finding Helpfulness, which can also be found on our website. You could download for free. It's a fairly comprehensive kind of social services directory for the state of Hawaii, broken up into different categories that are related to mental health, as well as by location, right? So you're able to identify the services or resources in your area. And then we have a Finding Help consumer guide as well. It kind of helps you navigate the mental health system just a little bit, right? But which you can also download for free from our website in a PDF version. Right, so I do like to do a little poll just to help us get to know each other a little bit. So this is something that should pop up automatically on your screens. However, if you are joining us on Facebook live stream, I also made a slide for you so you can see that, because I know the polls don't pop up through that Facebook live stream. So if you're joining us through Facebook, feel free to drop your answers if these polls pop up into your chat box feature and interact in that way. But let me pull up the very first one here for you, which is, when passing by a reflective surface, I A, use it to see if anyone is following me, B, check myself out because doesn't everyone, or C, use it to contemplate the deeper meaning of life. And I already see some people casting their votes. So thank you for that, for participating. I usually like to wait until we have at least a majority of people who have a chance to participate in the poll, which looks like we are pretty much there. All right, let's see what results we have. All right, so it looks like, I should have said that these are anonymous as well, so I encourage honesty in that sense, but I like that a majority of people voted for that check myself out, doesn't everyone, right? That makes me smile a little bit. So 63% voted for that B. We have 25% say they use it to see if anyone is following them, and then 13% say they use it to contemplate the deeper meaning of life, right? So the point with this poll that I'm trying to make is not only to kind of start us off on a lighter note, right, and have a little fun all together, practice using our poll feature, but the whole point of the presentation that we're going to be going through today, as well as the other ones that we offer through Mental Health America of Hawaii, is certainly not to try to turn anyone into a mental health professional by any means, unless you already are one. But hopefully with some more information, learning a few more tips, identifying different resources that are available both locally and nationally, we can just increase our noticing skills just a little bit more, right? And that's ultimately what we want to try to be doing, is just be aware, right? Be on the lookout. And then how do we help support a person who may be struggling with their mental health, right? So thank you so much for participating in that poll. Since you all answered, I will participate along as well. If I had to choose one, I would probably choose A, only because I'm a huge true crime fan. So like, I'm always wanting to be aware of people who are in my immediate vicinity or in my space that maybe shouldn't be. But there's no real right or wrong answer with this, right? It kind of depends on the person. It also really depends on the situation as well. But again, thank you for humoring me, right, with this poll here. So let's jump right into it and take a look at some statistics, right? So what does a snapshot of mental health look like for our youth here in Hawaii? So most of the statistics that we're going to be covering today are pulled from a couple different resources. So the ones I'll be highlighting is first, the Mental Health America of Hawaii as a national organization comes out with a State of Mental Health in America report pretty much every year. So this is their most recent report that has been made available. They say it 2021, but it really captures that data from 2020. From the ones we're highlighting today is from January to about September of 2020. We'll be taking a look at some statistics from the Department of Health, as well as the Youth Risk Behavior Survey, which is a survey that goes out to schools every couple of years. So anonymously self-reported data directly from youth themselves, right? So right off the bat, talking about major depressive episodes. So this is something that comes from that State of Mental Health in America report from MHA National. And what they found for that year, for the most recent report available, is that almost 13% of youth experience at least one major depressive episode in the past year. And of that almost 13%, we got 56% did not receive any kind of mental health services for that major depressive episode, right? So that's a little bit more than half, right? And that's kind of reflective of the kind of help-seeking behaviors that we often see with youth and their families, and just kind of really in general here in America, at the very least, is that there's kind of a national average on a delay in seeking treatment or delay in seeking services. So how long on average do you think it takes for someone who first starts showing signs and symptoms of experiencing a mental health challenge to the time point where they start seeking or receiving services for that mental health challenge, right? On average, on a national level in the United States, how long do you think that is? Feel free to use your chat box feature if you're here with us through Zoom, or your chat box feature if you're joining us through Facebook live stream, and just throw your guesses in there. All right, I see several months. I see 6 months with the question mark. That's okay. Take your best guess. That's why we're here to learn. And thank you for those of you who are dropping that in the chat box. I see 1.5 years. I see 6 months to a year. All right. Unfortunately, I just realized that I can't actually see the Facebook live stream chat. So if you're throwing that in there, hopefully Dr. G is also kind of monitoring that and acknowledging your answers if you're dropping them in there as well. These are all really great guesses. Thank you so much for putting those in the chat box. So on a national level, it actually takes someone an average of 10 years from the emergence of a mental health problem to actually seeking treatment for that problem on average. That's like the median, right? So 50% of people will seek and receive help below that 10-year mark, but 50% of people will also seek or receive help after that 10-year mark. So that statistic was a little shocking to me when I first heard it, because 10 years is a long time. And I think that's especially concerning for our youth, right? If we think about maybe a 13 or 14-year-old who starts showing signs and symptoms of anxiety, let's say, or depression, which are two of the most common mental health challenges among youth. And it's on average about 10 years before they seek or receive help for that mental health challenge. I mean, that's a long time. And there's a lot of things that are happening during that time frame as well. I mean, they're still developing physically, mentally, emotionally, socially. There's a lot of kind of life changes that are happening, transitions that may be happening as well. So, you know, when we hear statistics like that and see statistics like this, I think it's just so important for us to just continue having these conversations, right? To continue to raise awareness and even have these conversations with our youth. So we can send the message that it's okay, right, to talk about this kind of stuff. And hopefully the more conversations that we have, the more safe spaces that we can create for those discussions to happen, we can change that 10-year average mark and hopefully lower it a little bit, right? Because early intervention is best. We want to connect people with the help and resources as quickly as we can, even when it comes to mental health challenges. All right, so here is another set of statistics from Mental Health America as a national organization. So they actually offer several free online screenings, and one of them is a youth test. So for the month of June of 2020, this was kind of a snapshot of what they found for youth and different ages as well, who were still disproportionately experiencing depression and anxiety. Now, I will say, this is kind of, you know, like right when we're in the middle of a pandemic, which we are still kind of dealing with to this day. But it was really interesting when they came out with this graph specifically, because what they found was it wasn't just the pandemic that was causing an increase, right, in some of these numbers that we have been seeing, or that led to this disproportionate amount of youth experiencing depression and anxiety. What they found was that there were other kind of larger societal factors as well that were also contributing and still are contributing too. So not only a global pandemic, which might be a little redundant now that I think of to say, because I think pandemic means global, but also the political divide of our country today, right? The social and racial unrest that we've been seeing across the nation in every single community. So even these kind of larger, you know, societal factors are having an impact on everyone's mental health, but we can see that in actual graph here, right, with real numbers and real statistics for our youth as well. Okay, so here's a graph from the Department of Health, right, that reflects the top causes of fatal injuries here in Hawaii. So to orient you a little bit to this graph, on the left-hand side, we have rankings of those top causes. Across the top, we have the different age groups as well. And this is for the years of 2015 to 2019. So in those blue boxes, we can see that suicide is one of the top causes of fatal injuries here in Hawaii. I would say fairly across the board, but we do see them as the top causes for our youth and those kind of younger ages as well. Right. So, whenever I see statistics like this or graphs like this, or even the couple past ones that we saw, it's always very concerning for me to see that suicide is so high up there on that graph, right? And it may be concerning for you all as well, and that's okay. I think that's a very healthy response to seeing something like this, and it's encouraging that you all are here showing up wanting to learn more about how best to support our youth. But I always like to find a little piece of hope, right? Even when we're looking at charts or graphs like this, is that, where are the places that we can help? Where can we step in and intervene? Or where are prevention efforts going to work the best, right? So if I can provide an example for you, if we think about motor vehicle accidents, right? We've seen the number of motor vehicle accident related deaths decreasing over the past couple of decades. And that's really because there has been a vast amount of prevention efforts that have been put into preventing car accidents, right? Safer vehicles, traffic laws, requiring seatbelts and airbags, raising awareness about drunk driving or distracted driving, right? So if we put that same kind of prevention effort into suicide prevention, I really think that we would also see a change in these numbers when it comes to fatal injuries related to suicides as well, right? So there is hope, there is something that we can do, and we know that prevention does work. Right, so the next set of statistics that we have actually comes from the Youth Risk Behavior Survey. Again, that survey goes out to schools every couple of years. The most recent data we have available is from 2019, so still even pre-pandemic up until this point. But on average, the questions that they ask on that survey capture how many students are self-identifying that they have had suicidal thoughts before, how many have made a plan, and how many have had made an attempt before. So this is kind of like a summary of that data from those three questions from that Youth Risk Behavior Survey. So we got 1 out of 4, about 24% of middle school students, and 1 out of 6 high school students self-reported that they have had suicidal thoughts. We got 1 out of 6 middle school students, 1 out of 7 high school students reported making a plan. We have 1 out of 8 middle school students and 1 out of 10 high school students reporting actually have made an attempt before. So again, maybe a bit concerning for us because some of these numbers are a little high, right? Especially I think for our middle school ages. So again, maybe a little shocking and concerning for people to see. But again, I think that's a healthy response, right? It hopefully may inspire us to want to learn more and want to do better in supporting our youth. And again, if I can give you a little piece of hope when looking at even these numbers here, these self-reported numbers, is that we actually see these numbers decrease as we move along this spectrum, right? As it gets a little more serious. So from someone having thoughts to making a plan to actually making attempts. So we can look at it just as that, not everyone who has thoughts about suicide, not everyone who makes a plan, not even everyone who attempts suicide actually dies by suicide. So what that tells us is that there are a lot of opportunities, again, for us to step in and help, or for us to even reach out for help before it actually reaches that point. Right, so with these presentations, the presentations that we give are any ones that I actually attend as a participant. A lot of times people are really focusing on and talking about the risk factors, right? What are those things that are in a person's life that increase their risk for developing a mental health problem or for suicidality? And what's often missing in these conversations as well is what are the protective factors, right? What are the things that are also in a youth's life that's going to help combat all of those risk factors and increase their sense of resiliency. So I like to include a couple statistics as well to continue building that sense of hope for ourselves in wanting to help support a youth, is that these come from that Youth Risk Behavior Survey. So self-reported data as well. For these questions specifically, the most recent available we have is 2017, but we see that almost 84% of middle school students almost 82% of high school students felt that they had an adult or a teacher that they could talk to at home or at school about things that were important to them, right? That mattered to them. And, youth are fairly resilient, and that sense of resiliency increases with the support from adults and peers from a youth's life, right? So there is a study that came out a number of years ago called the Kauai Longitudinal Study. And this was a study that followed a group of youth over a couple decades. I think it was a period of over 30 years. And what they were looking for, what were those factors in those youth's lives that really helped increase their sense of resiliency. And what they found was three major pieces. So number one, having a supportive adult, right? Doesn't necessarily have to be a parent or guardian. It could have been a teacher, counselor, coach, right? Family friend, auntie, uncle, grandparents. Having one supportive peer, right? Or meaningful peer, and having one meaningful activity. Having those three things in that youth's life greatly increase their sense of resiliency, right? So we want to be focusing on what these protective factors are, because the more energy that we can put towards bolstering and making those protective factors stronger, the more impact we are going to have in also increasing that sense of resiliency for our youth, which I think is something that is super important, especially given, how the world is right now. Right, and this is a very similar question that was asked, but they, in that kind of school setting, how many felt supported, right? But at least one teacher or other adult in that school, they felt that they could turn to when they had a problem, right? To build that trust a little bit, create those safe spaces that they could turn to that supportive adult within that school setting, right? So again, it just shows that, there are a lot of different areas and settings where that support can also happen. So again, we want to continue to foster those supports and foster and bolster those connections as well. All right, so let's keep moving on by touching upon the different kind of challenges, right, that are present when it comes to talking about mental health, or when it comes to those help-seeking behaviors. So what is it that we know or don't know about mental health problems? What are some of those missing pieces? And maybe what are some of the pieces that might no longer fit? So jumping right into it, we know that there is a need, right? Mental health problems are common. About 1 in 5 Americans will experience a mental health challenge at some point in their lifetime. And what we also know is that these mental health problems often develop during adolescence, right? So half of all mental disorders actually begin by the age of 14, and 3/4 begin by the age of 24, which again is just another testament as to why it's so important that we are having these conversations even with our youth, and that youth are helping to support each other as well, right? They're having these conversations with each other and checking in too. Youth and young adults may experience mental health challenges a little differently than adults do, and that pretty much makes sense because, as I mentioned before, they're still kind of developing, right? So physically, emotionally, socially, it may have an impact on their experiences, right? So it may be hard to tell sometimes what is, a mental health challenge or a mental illness versus what might be kind of typical or healthy adolescent development, right? And youth may not be well informed. I think this is also true for some adults, right? May not be well informed, but there is a lot of really great information and resources that are out there that we do want to share. We just want to make sure that the information and resources that we are sharing are from reputable sources, right? That we're doing our homework, that we're doing some fact checking before we are sharing those pieces of information. But I think it is important to share that information and those resources. Right, so another challenge kind of area has to do with trying to access services. So barriers to receiving treatment may include or be related to having no insurance or even a limited amount of coverage, right? Especially over the past year when many people have unfortunately lost their jobs and may have also lost insurance coverage, or that has maybe changed in some way. So there may be a limited amount of coverage. We have an overall shortfall of psychiatrists and really kind of an undersized mental health workforce here in the state of Hawaii, especially on our neighbor islands. We also see kind of a disconnect between primary care systems and behavioral health systems, right? So, historically people thought of mental health and physical health as being two separate things, right? Two separate areas that, require separate amounts of attention. But I think there's been a shift of thinking, hopefully, maybe that's just my hopeful Amanda piece of me thinking that, but that we do see a connection between our physical health and our mental health, because when we take care of one, that has a positive impact on the other and vice versa, right? And we see these kind of physical manifestations or symptoms of mental health challenges. We feel it in our bodies, right? When someone has to give a public presentation, even in a virtual format, they get a little nervous, might have some anxiety about it, and their stomach starts to hurt, right? Or maybe you're rushing to finish that report, or youth may be rushing to finish that homework assignment, turn it in last minute, but they also want to get a good job, do a good job on it. And they start to get a headache, right, from that buildup of stress. So thank you, Eddie. So we see these kinds of physical manifestations, right? So there is definitely a connection between physical health and mental health, and the overall person should be treated, right? But it's something that should be addressed on both fronts, right, to have the most impact. That barrier to access can also be related to finances, right? So even beyond insurance, maybe there are insufficient finances to cover the cost of copays or even inpatient hospital stays. Maybe the providers that they are wanting to see and feel comfortable with stop taking their insurance, right? So it's hard for them to just pay out of pocket for those services. So again, I'm just kind of introducing you to all of these barriers because I think it's really good to be aware of what they are, especially when we are trying to connect to a youth and their families and try to address some of these barriers, find some workarounds or find some different options and getting them the help and resources that they need. Right. Another kind of area or challenge area is related to stigma, right? So this is kind of one of the bigger ones. This is one that has been around for a very long time and unfortunately still is around when it comes to mental health. One of the biggest challenges is that kind of stigma, right? And stigma affects mental health in so many different ways, but what it has that especially kind of hurtful or harmful effect is of silencing that discussion of mental health, right? It makes people not want to acknowledge mental health problems, to not want to talk about it, and not actually seek help or services, right? Some people may think that, it's just something inherently wrong with that individual, like it's a moral or character flaw. Some may be thinking that's not me or my family, right? No one in my family or nor myself have experienced mental health challenges. It doesn't really exist in my immediate vicinity, so it's not really happening. But we know from a couple slides ago that mental health problems are common, right? So it could very well be happening. It's just kind of happening in the dark. Some people have looked at reaching out and seeking help as a sign of weakness. And I think the actual opposite of that is true. If someone is able to recognize that they need a little extra help and support, or they're at least willing to be open to receive that help and support, that's a huge sign of strength because that's not always the easiest thing in the world to do. And of course, we see kind of negative portrayals of mental health challenges and mental illnesses in our media, right? I won't name super specific examples, but I'm sure we can all think of a couple events that happened recently where we see a negative portrayal, right, of people's mental health, right? So, that's not really reflective of the research when it comes to mental illnesses. People who experience serious mental illnesses actually only account for a very small portion of violent acts or violent crimes, but that's not what we see portrayed in our news and our media, right? People who experience serious mental illness are actually more likely to be the victims of violent crimes than they are to be the perpetrators. But, again, raising that awareness and having these conversations are ways to kind of combat that stigma. But I want to do a little activity really quickly with all of you to kind of portray that sense of stigma. So in your chat boxes, either through Zoom or Facebook live stream, what are some words or phrases that you have heard used to describe someone who has a mental illness or a mental health challenge, right? So this could be something that you've read in the news, that you've heard on a television show or a movie, that you've heard people in the community kind of throw around, or people in our family when they talk about mental health. All right off the bat, I see weak. Yes. I see unstable and unbalanced, overreacting. Yes. Crazy, nuts, cuckoo, all of those. dangerous, untrustworthy, weak, unable to cope, dramatic, drama. Yeah, only happening in your head, right? It's not an actual reality for everyone. It's just you, right? So all of these things, and I apologize again to my Facebook live stream friends that I can't see your answers if you're dropping those in the chat box, but I'm sure they're very similar to the ones that I'm seeing in the Zoom chat, because these are definitely words and phrases that we've heard used, right? Needy, exactly, to describe people who have mental illnesses or experience mental health challenges. And, words are powerful. Language is a really powerful thing. So when we're using words and phrases like this, what we're doing is we're only adding to the stigma, right? So we need to be really conscious and aware of the words and phrases that we are using. And I'll show you an example, kind of what I mean by that when we get to the solutions portion for this presentation. But I like to do this activity. It's a little different in a virtual format, but the reason why I have Post-it notes up on the slide as well is because when we were able to do this kind of activity in person, I would have everyone write down that word or phrase on an individual Post-it note. I would ask for a volunteer or have my co-trainer stand in the front of the room, and we would just place all of those Post-it notes on a person's body. And it was just a visual representation of what stigma is, that we're associating all of these words like crazy, nuts, drama, dangerous, untrustworthy, right? Something that's only in your head, to an actual human being. And that's exactly what a person is, first and foremost, is a human being, right? We should be modeling that kind of person first language. And by using those words and phrases, what we're doing is just letting that stigma kind of continue on. Right. So we have also seen some kind of pandemic related challenges over the past year for our youth. So there was definitely a huge disruption of education, of schedules and routines across the board for everyone, but especially for our youth, right? I mean, a year ago, they went on spring break and they just never really went back to school, right? And even since then, there's been attempts at, going into blended learning formats or totally remote learning and being really flexible and moving back and forth between the both or the two of those kind of models. So it's been, a challenge over the past year, I think, for everyone to kind of reestablish our routines, right? Kind of change up our routines a little bit, reset our schedules, but also having to be flexible, right? Because we can't always tell what's going to happen in the future. We saw a lot of people missing milestones, right? So graduations had to be canceled, school dances, right? Birthdays, anniversaries, other kind of larger celebrations, we weren't able to celebrate and honor that person in the way that we could before, right? Because yes, we are practicing that physical distancing. We want to keep our friends or family members in the community at large safe. So unfortunately, that means that we can't just gather together with our family members or go see a movie with our friends. I'm saying we, like I'm a youth still, but youth couldn't go, hang out at the beach all together anymore, or go to the park, or hang out at the mall, whatever that might be. We saw inequalities that definitely existed before the pandemic become even more pronounced during the pandemic, right? Schools were no longer able to be a source of regular meals, right, in the same way that they were before. Some students didn't have access to a laptop or access to Wi-Fi or the internet to be able to participate in that kind of distance learning. So all of those inequalities that were existing before the pandemic, we just saw becoming even more pronounced, right, because of everything else that was happening as well. And then in general, we have seen an uptick in mental health challenges really across the board, but even amongst our youth, as we saw kind of with those statistic numbers there a couple slides ago. All right, so now moving on to the third kind of portion of our presentation today, which is how can we help, right? So one of the biggest questions we often ask in public health, which is my background and kind of the approach that Mental Health America of Hawaii takes with all of our trainings and presentations, is that, so what, right? Now that we've done all of this research, we've established that there's a need in our community, so what are we going to do about it, or what can we do about it? So to provide a little bit of perspective, I know this might be scary to look at for some of you, because when we think about theories or models, it's like, oh my gosh, right? I'm tired of hearing about all of this stuff. So I won't make you memorize this and I won't test you about it. Rather, I will summarize this for you. But again, our main focus at Mental Health America of Hawaii is a very public health approach on prevention. So this is the social ecological model. In summary, this is a theory that states for any prevention effort to be effective, right, and to be sustainable, that it needs to be happening on multiple levels, right? So what are we doing on an individual level? Teaching our youth the importance of practicing self-care, of identifying different coping skills. What are we doing on an interpersonal level to really bolster and foster those connections that our youth have with their peers, with their family members, and other supportive adults that they have in their lives? What are we doing on an organizational level, right? So how are schools working to help support the mental health or mental wellness of their students? What are we doing on a community level? So how are schools and maybe different community organizations actually working together to help support the mental wellness of youth that they work with or interact with? And then ultimately, what are we doing on a societal level, right? What kind of policies are in place or not in place that are helping to support mental wellness and increase access to services? Culture is also something that always needs to be running in the backs of our minds because it's so influential on how people look at health and how they make healthcare decisions as well. And what other kind of social norms are in place, right? So kind of hinting at that stigma or those larger kind of help-seeking behaviors, you know, to prevent or to help create those barriers, right? And then also on the other side of that, how do we break some of those barriers down, right? So many of the challenges that we just talked about can be considered or thrown into that kind of risk factor category. But again, there are a lot of things that are in a youth's life as well that could be in the protective factor category that'll act opposite of all of those risk factors. And we can identify protective factors in each of these levels as well, right? So just kind of a summary of a model and kind of approach that we take at Mental Health America of Hawaii, but also hopefully a little inspirational to all of you in whatever capacity that you work with or interact with youth, that we all kind of work together, right? That we're all collaborating and filling those missing pieces to help support the youth that we have in our lives. So one of the kind of broader categories of solutions, which is how I'll be presenting it to all of you, unfortunately, within an hour's time frame, I can't solve all the problems of the world. I think if I had all the time in the world, I couldn't solve all the problems in the world, but here are some kind of general ideas, little pieces of information I want to drop to you just to plant some seeds a little bit. So one of them is to talk about it, which I've mentioned quite a few times already. So sending that message that it's okay to talk about mental health. You know, it is important that we are having conversations about mental health, that we are creating those safe spaces that are necessary to have those sometimes uncomfortable conversations. But it's also just as important to be mindful about how we are talking about mental health as well, because the last thing that we want to do is add to that stigma, right? So a couple different examples. I've already talked about a little bit media portrayal, but the one I want to highlight for today is to talk about modeling person first language, right? So what exactly do I mean by that? Here's a wonderful little chart that comes from the Centers for Disease Control and Prevention about what I mean by modeling that person first language, right? Words are powerful, and how we talk about mental health is especially impactful. So we want to put the person first, right? A person is not only their diagnoses or just one piece or facet of their identity. There are many other parts that make up that person as a whole and as a human being. So instead of saying things like insane, crazy, psycho, nuts, drama, dangerous, all those things we kind of brainstormed a couple slides ago, we can say a person experiencing a mental illness or a person experiencing a mental health challenge, right? Person with emotional or behavioral disability. So we are putting that person first because that's exactly what they are, right? Now, this is not an easy thing in the world to do. This isn't something that's going to change overnight, only because a lot of those words and phrases can, or they have been around for a long time, right? So, you know, it's hard to kind of shift people's language and thought processes, but it is definitely possible, right? So again, we want to send that message that this is definitely something that we can talk about. It's not a problem to have a problem, but it is a problem if we feel like it's something that we can't talk about or we can't reach out for, right? So again, words are powerful. We want to think about how we are talking about mental health so we're not contributing or adding to that stigma that's unfortunately still associated. And by having these kinds of open conversations and discussions about mental health, another piece of that is that we may be providing appropriate language for our youth to also talk about what they are thinking and feeling, right? Because that, isn't always the easiest thing in the world for an adult to do. And so expecting a youth to kind of verbalize what it is that they're thinking and feeling and to specifically identify emotions may take a little bit of brainstorming, right? And a little bit of help and support in that as well. Right. So another kind of category of a solution that we can think about is supporting each other, right? So checking in with the people in our households who we are practicing physical distancing alongside with, checking in with our friends, our loved ones, our family members, or people that we have in our social circles who we may be practicing physical distancing with. And luckily enough, we do live in a world today where technology still allows us to be able to do this in creative ways, right? Again, yes, we're practicing that physical distancing, but that doesn't mean that we should be isolating ourselves in any way. We still can connect with and get together following safety guidelines now that things are starting to open up a little bit. And bolster those connections, right? And still check in. That could be something as simple as sending a text or making a phone call or writing an actual letter and sending it through oh my gosh, it's been so long. I'm just so technology mind oriented right now, but through the mail, right? Through snail mail, for lack of a better term. Right, through video chats, through streaming movies together, through having game nights, right, through Zoom or dance parties or virtual study sessions, right? We can get really creative and still be able to connect with the people that we care about and who care about us as well. And another important piece of checking in is also checking in with our own selves, right? Am I the right person to help support this youth or to help support someone in my social circles or, within my family or within my friend groups, right? Do I have that mental or emotional capacity to really be there for that person, right? If you're not, or if you're not in that place at that moment, that's okay, right? We can help connect that individual to someone who can be that person for them, right? It is a journey, it is a process, but at the very least, we could be alongside them in that process and connecting them to the help and resources that they might need during that time. We want to do our best to listen actively and without judgments, right? So listening seems like the easiest thing in the world to do, but it actually takes some work. So I think I have a poll, another poll for us. So again, something that should just pop up automatically on your screens. If you're with me through Zoom, unfortunately through Facebook Live, it won't pop up, and I didn't make a slide for this, but I want you can reflect on it, maybe drop your answers in the chat boxes. The question is, how good of a listener are you? And the choices are, I'm a great listener. The second choice is, I do all right. The third choice is, it takes a little work for me to really listen. And then the fourth option is just what? Like, huh? So I see a bunch of votes coming in on my end here. So thank you for those of you who are participating. My poll. So for time's sake, let's see what kind of results we have here. Okay, so we got a majority of 63% saying, I'm a great listener. That's awesome for me to see and for me to hear, right? And then we have 38% say, I do all right, right? I think that's a great thing to do as well, because it actually takes work, right? We didn't have anyone vote for it. It takes a little work for me to really listen. If you were thinking that, or you were going to vote for that, I think that's even okay as well. And thankfully, no one voted for the last one, which is just what, right? I don't even know what you're talking about right now, Amanda. Like, I'm just not even present here with you. So that is encouraging for me to see. But it's not always the easiest thing in the world to listen, because it means more than just sitting there letting someone talk at you, right? It's listening with our ears. So being aware of the things that people are saying, or maybe what they're not saying, reading in between the lines a little bit. It's listening with our eyes. So being on the lookout for changes in behaviors, right? Or changes in patterns. Is someone acting differently than they normally would? And it's listening with our hearts and with our stomachs as well. And I know that's not a very scientific thing for me to say, but if something that someone says or something that someone does just doesn't quite sit right with you, or it gives you that bad feeling in your stomach, don't just ignore that, right? That instinct could be there for a reason. So follow it up with some more questions, like, are you okay? What's going on? Is there anything I can help support you with? But sometimes that also means asking some of those tough questions, especially if it's someone that we are concerned is suicidal or having thoughts of suicide. We do need to ask them, are you having thoughts of suicide, or have you been having thoughts of killing yourself? You know, it's a thing we've heard that we don't want to ask those kinds of direct questions. We don't want to talk about suicide because we don't want to put ideas in people's heads or plant any seeds. And this is just not true, right? By asking those direct questions, you are not putting the idea in someone's head. If we don't ask, then we don't know. And if we don't know, how can we help that person, right? So it is important, if we are concerned someone may be suicidal or in a crisis, that we're asking those really tough, direct questions. However, I will acknowledge that it can be a really hard and uncomfortable question to ask, especially if it's someone that you care about. So if you feel unprepared in asking that kind of a direct question, that's okay. There's even help and resources for situations exactly like that, which we'll be covering and giving to you a little bit later on in the presentation. There's a lot of really great crisis resources and helplines that we can call 24/7. Right? And then that last bullet point is just really straightforward and kind of echoes everything I've been talking about throughout our day, is that we want to encourage help-seeking behaviors in people, and especially in youth, sending that message that getting help is effective, right? It does work. There are a lot of different ways to seek and receive that help as well. And if you yourselves need help kind of identifying those different areas of support or different areas of services, again, feel free to call us at Mental Health America of Hawaii. We're always happy to point people in the right direction or help provide any kind of resources or pieces of information that you might be looking for, right? So there's different kind of campaigns that are out there from really awesome national organizations that help to raise awareness, right, and open up that conversation. One of my favorite ones is Seize the Awkward from the American Foundation for Suicide Prevention, alongside with the JED Foundation. Unfortunately, during the time frame for today, I don't think we have enough time to really show this video, but I will include the link to this video when I follow up with all of you with the slides. So if you're on Facebook live stream, feel free to reach out or take down our email as well, so we can get this link to you and the slides as well. But it's a really great example of the kind of videos that are out there that just help to raise awareness and how to start having that conversation, right? That it can be a little awkward, but we can take advantage of, or the opportunity, find opportunities in those awkward moments just to ask, is someone okay, right? Or how are they doing? Right, so another solution that we have for ourselves, say in the broader category, is to be involved, educate yourselves, which is exactly what you are all doing here with us, right? Is showing up, wanting to learn a little bit more about how to best support the youth that we have in our lives. It's spreading awareness, right? Having these conversations. It's attending and sharing information about different kind of virtual community events that are still happening and still going on, right? We just had a conference for NAMI, right? So the National Alliance Against Mental Illness, I believe. There's so many acronyms out there and I always jumble them around. Just a couple of days ago, right? And it was really awesome. It was a beautiful experience. We've got a couple events coming up for the Hawaii Public Health Association, for Mental Health America of Hawaii as well. So, you know, these events are still happening. They're still out there. Thank you, Daniels, for dropping that link in the chat. Can you drop it again if you don't mind, making it available to all attendees too, so people have that? It's a video link to that Seize the Awkward campaign that I was just mentioning. If you have a chance to check it out, it's a really awesome one. And you can also follow our own kind of advocacy and training efforts as well by signing up for our newsletter, checking our website, or just reaching out to any of the staff people here. You know, we're always happy to help and provide you with that information as well. Okay. And then the last kind of solution that we have for ourselves is just take care of yourself, right? This is hard work, so thank you for doing it. Thank you for wanting to learn more about how to, you know, best support a youth that you have either within your professional capacity or in your personal lives as well, right? You know, we've talked a lot about having empathy and compassion for other people, and I want you to take that advice and all of these solutions and apply them to yourselves too. We're all just doing the best that we can, right? So as long as we're putting our best foot forward, we're making our best effort, that is good enough. But that also means taking care of our mental health too, carving in that time for self-care to happen, right? Self-care is not a selfish thing to practice. We want to be prioritizing our self-care time, even if that's only 5 minutes out of your day, a couple times a day, that is going to have a positive impact on your mental health. So take that time to really brainstorm what it is, right, that works for you, the things that you can add to your self-care plans. whether that's people, whether that's different places that you go to practice self-care at, or whether that's different activities, and change it up every once in a while. You know, really identify the people and the places and the activities that are going to work for you in different situations or when you may be experiencing different emotions, right? So as helpers, right, or if you are that kind of helper person, we often sacrifice our own needs for the sake of others, or really put ourselves kind of last in line when there's little left over. But it is important that we are taking care of ourselves, so we can help show up and take care of other people, right? We can't pour into others when we ourselves are empty. So we got to take that time to recharge our batteries a little bit, right? So whatever that looks like, sounds like, feels like, tastes like for you, take that time to brainstorm, right? And carve out that time for that self-care to happen. Really prioritize that for yourself. So as promised, here are a couple of different resources that are available both locally and nationally. So if you or a youth that you might have in your life has tried all of your self-care or coping strategies and you still don't feel better, this may be a good time to reach out for that extra help and support. So let's go through some of those resources that are available. Again, we're going to make these slides available as well as a handout of resources as well. But we have the Hawaii Cares Line, which was formerly known as the Crisis Line of Hawaii. So they still offer that 24/7 kind of crisis intervention services for the state of Hawaii. But what they also offer is they've kind of expanded their services to include anyone who is seeking mental health services or substance use services can also call that Hawaii Cares Line to be connected with case managers or people or organizations who are specifically offering those direct services. We also have the National Suicide Prevention Lifeline. So again, also available 24/7. If you find yourself in a situation where you don't know what to do, you don't know what to say, or you yourself might need a little help and support and you can't necessarily reach out to anyone right away, call these hotlines. You know, that's exactly what they're there for. If talking on the phone is not something that you are super comfortable with, or your youth that you're interacting with isn't super comfortable with, there's even a crisis text line. So you can send a text to 741-741 and someone will always text you back wanting to help. We also have the Trevor Helpline, which is a really awesome resource for our LGBTQ plus youth. So if you have a youth in your life who identifies as lesbian, gay, bisexual, transgender, queer, is not sure, or any of the other identities that are out there, or choose not to be labeled by an identity at all, this is a really great resource to pass along to them. They've got their own kind of 24 hours a day, 7 days a week helpline. They've got a chat feature as well. They have ways to connect with other LGBTQ plus youth in a safe and monitored way, plus just a vast amount of information and resources on their website as well, which is thetrevorproject.org. So Mental Health America of Hawaii created a suicide prevention app a couple of years ago. We're still kind of working on those updates, so you may be able to find it if you have an iPhone. But unfortunately, I think for Androids, it's still unavailable in the Google market, but there's a lot of other really great free apps that are out there as well. One of them is the COVID Coach. So something that was created just to help support people's mental health during a pandemic, right? So education about different ways to cope, right? And how to practice self-care, right? Actually teaching you what those skills are, providing you with ideas. There's also trackers where you're able to kind of track your mood from the day to day and maybe really measure your growth, right, towards personal growth, personal goals. And it's just really awesome to see different graphs to kind of visualize your progress over time. So that's just one example of a free app that's available to download and able to use to help support your mental health. I mentioned earlier in the beginning as well that you know, there are a lot of really great free online screenings that are out there, which can be accessed through our website, mentalhealthhawaii.org. So one of the quickest and easiest ways to tell if you may be experiencing a mental health condition is to take a free online screen, right? So we got about 9 different screening tools for various mental health conditions, including a youth test, right? So I will say that while these screenings are not meant to diagnose someone or even ourselves in any way, they can be used as a really good starting point in finding out some more information, right? You can take those results and recommendations based on your tests to your doctors, right? Or to a mental health professional just to figure out next steps. Right. We are also on Facebook and Instagram. We're on social media, and I'm hoping I got our general Instagram name, right? I was supposed to check with Dr. G before this. But we are on Facebook. We run a couple different groups. So we have a Keiki group if you're looking for fun activities or cute videos to watch, different exercises related to mindfulness to do alongside with your little ones. Feel free to join that group. We have a book club. So if your reading is something that you're into, we offer monthly book recommendations as well. We drop the fun quotes or inspirational quotes in there too. We have an MHAH Maui group too. So if you live or work within Maui County and want to connect with other people, feel free to join that group as well through Facebook. In South America, Hawaii is just our general Facebook name. If you're on Instagram, at Live Owl is kind of our self-care page where we post different ideas and ways to practice that mindfulness and to take care of our mental health and why that's important. And then once again, our general kind of Instagram page, hopefully I got it right, Dr. G, is MHA of Hawaii. Okay, we post every so often on there, so connect with us on social media, right? We're trying to find all these ways to still stay connected with each other, and I know that social media is one of the biggest ways to still be able to do that. But with that, that's all I have for you today. I will open it up. I'll stick around for another couple minutes to answer any questions that you might have. If you have any comments, I already see a couple dropping into the chat box. Feel free to drop them in there. If you have resources, even beyond the ones that I kind of touched upon today, that you want to share with the people on this webinar, feel free to drop those in the chat box as well. I think it's always a great thing to spread information and resources as far and as widely as we can. But I'll kind of start closing out. I want to honor your time by just saying thank you so much for joining us today, for taking that time to show up and to learn a little bit more about what mental health looks like for our youth and how we can best support them, right? I hope you found it helpful. Again, I will be following up an email with all of these slides and a link to the recording as well, but I'll also stick around for a couple of questions or for a couple of minutes just in case there are any questions that might pop up. But with that, thank you so much everyone who has joined us today. Right, so we have someone who has the Cocoa Life app on their phone. Awesome, so you're able to download that, but it's still able to be downloaded. And they're subscribed to our Facebook page. That's awesome to hear. Right. Thank you, Miss Danielle Bergen, for dropping our YouTube page in there as well. And thank you, Dr. G, as well. If those questions pop up later, or today, next week, next month, whatever that may be, feel free to reach out and contact us. Again, we're always happy to answer those questions or provide any information or resources that you might need. All right, so one quick question I see has come in. So what was the third condition for youth resiliency in that longitudinal study? Yeah, so I'll type it was called the Kauai longitudinal study. And so what they found were the three things that greatly increased a person's or youth's resiliency was having one meaningful adult, one meaningful peer, and one meaningful activity, right? So those three things greatly increase those youth's sense of resiliency. So thinking about the supportive adults that we have, thinking about those meaningful peers and connections that they have with their friends and classmates, and what kind of meaningful activities are in that youth's life as well. Great question, though. I'm glad I was able to answer it. I'm not seeing any other questions drop into the chat box or into the Q&A feature on my end. So with that, we'll go ahead and end the session. But again, thank you so much, everyone, for joining us today. I hope you have a great rest of your day, a great rest of your week, and find that time to really practice that self-care for yourselves, right? Take care, everyone. Thank you.